Namaskar, a very special good afternoon to all of you. As you know, we are introducing our third international conference on World Mental Health Week. And today, in this session, we have a very special guest with us, Honorable Dr. Pradeep Kumar Khatri, sir. He is a director at Sambal Drug De-Addiction and Psychiatric Hospital, also a ex-professor and HOD at Department of Psychology, National PG College, University of Lucknow. His today's topic is effect of substance use on mental health. So, not taking too much time, I would like to invite honorable guest to present his views on a very important topic. If anyone has any query or question, you can ask directly in the live chat of the YouTube. Once again, thank you so much, sir, for providing your valuable time. You can start.
Now, thank you, sir. Thank you. Thanks a lot for giving me this opportunity to talk about the effect of substance use on mental health. My very happy good afternoon to each of my delegates, friends, viewers, and everyone. It's our privilege to be here with you to share our views about the use of substance and their effect on mental health. Before starting our explanation, our debate, I'll just share a quotation which will just explain about the whole theme of this afternoon, our discussion. As the topic was known is known to you, that effect of substance use on mental health, so I'll say that abuse use of the substance is not only affecting the user, but it also affect the entire family members, caretakers, and each and everyone. So what I said, that I'll start with a quotation. It is very simple, that remember, if one addict is there in any family, the mental health of whole family becomes disturbed. Quite obvious. So it should be known to each and everyone about the management of the addicts to maintain peace and harmony of the family as well as of the society. Now, it is very much clear that how does a addict, a substance user, affect the entire family, the vicinity where he or she is living, and the society in which that user of the substance belongs. Before that, coming to the substance, a very quick explanation, I would like to explain that what is the health and why the health is important, and why this World Mental Health Week or the month is being observed. Because health is one of the very important segment of any individual's personality. And what the health is, it is nothing. It is only a state of complete physical, mental, and social well-being, and not merely the absence of disease. We have so many confusions, we have so many myths that health means disease. No, not at all. Health means that our well being, our happiness, our gratitude, and all those things which gives the satisfaction to an individual. It is the myth that when we talk about the mental health, it is also that any sort of the illness at the cognitive level, at the mental level, at the conscious level, then we talk about the mental health. But remember that this mental health causes the physical health. The physical illness is due to mental suffocation or mental alterations. So, in one word, what we can say that mental health is that state of well-being in which every individual realizes his or her own potentials, capabilities, abilities, and he or she may cope with the normal stresses of life, can work productively and faithfully, and is able to make a contribution to his or her own community, for her own family, for her or his own uh, mm, cognitive level, for himself or the herself also. So this is the mental health. But what affects this when we are not able to cope up with the stresses of life, with the problems of life, with the tensions of life, then we start depending on the substances. Because what happens then when we are unable to cope up with our natural uh, abilities, when we are not able to know about the potentialities, about our own capabilities, then we use to depend on the substances. Here, one thing more I would like to make it very much clear that I have just included the word use, and there are uh, three uh, sort of the terms which frequently being used for the drug user. That is one very simple, which is in front of you, that the use, that substance use. That means if any drug is used for cure of illness, to prevent a disease, to improve health, then it is being used. And in nutshell, what we can say that drug use means how much any consultant, any physician, or any person recommended that you can use this. But what is the abuse? Abuse when any substance or any drugs are taken for reasons other than medical in an amount, strength, frequency, or manner that damages the physical or mental functioning of an individual is called drug abuse. That means when you use this sort of the substances to cope up with the situations, to cope up, not naturally, when you want to get adjusted artificially, then it is drug abuse, where the quantity is not specified, the frequency is not specified, and the manner of taking the substance is not specified. And the last thing is as the dependency. That what the drug dependency? Drug dependency is one of the psychic correlation and sometimes physical conditions too. Your body demands it. If you are not taking the substance, particular substance, I will just discuss what are the types of the substances. You are not taking that particular type of the substance, that particular type of the drugs, then some body problems arises. You become a violent, you become aggressive, you become some angry sort of the thing. You may have the tremors, you may have some blackouts, or any sort of the things may happen that your body demands. You are not able to sleep or something like that. So this is the dependency. So there is substance use, abuse, and dependency. Here, I just you put the term use. Use means if the prescribed substance is being used, no harm. Mental health will not be affected. But if it is abuse, then it creates the problem uh, at the mental health level. Now, what the substance is, it is nothing. Any substance is known as a drug. And any drug which by its chemical nature alters the functioning of living organism, of the functioning of a living individual. So this drug or substance may be a pharmaceutical preparation or naturally occurring substances. It is being used primarily to bring about a change in some existing physical or mental state or the level of consciousness. As I told earlier, when you are very much stressed, when you are very much worked up, when you are not able to take the proper decision, then either you want a black cup of coffee, you want a cup of tea, you want to smoke a cigarette, you want to have some tobacco or something like that. Initially, if these things are not activating your conscious level, then the individual progressively go ahead for another type of the substances. So what the feeling an individual may develop when he or she is using the substances. On the use of the substance, the person may experience rewarding effects. Rewarding effects may relate pleasant feeling, extra strength, stresses go away, reduction in negative thoughts, reduce the fatigueness, reduce the anxiety or other mental or physical problems. But here the but is very important, because all these things, all these rewarding feelings, all these pleasant feeling is very temporary. Till you have in the impression of that particular substance, only by that time you will be feeling relaxed. So that's why I initially said that it is the artificial sort of the relaxation ability, and it is just induced your potential and capabilities. What we should do, that we should develop our own potentials and capabilities. We should do some that sort of the activities or something like that. uh, Now, another term which is being used in this reference or in this condition, that is the addiction. The person start taking the substances for the rewarding, for the fun, for the pressure of the friends, society, peer pressure. But gradually and gradually, what happens, that it just converts in the form of the addiction. So now, how you can explain the addiction? Addiction is nothing. It is any psychological or physiological over dependence of an organism on any substance. Physiological dependency is characterized by habituation and withdrawal symptoms. I just explained earlier that dependency, the body demand is there, the various body symptoms is there. For example, the person who is having heroin or the smack or the brown sugar, if he is not getting that particular substance, he just feel a whole body pain, the watering from the eyes and the nose or something like that. These are known as the withdrawal symptoms. So habituation and withdrawal symptoms are there. This if the individual has developed physiological dependency. Uh, when the withdrawal symptoms occurs, when an individual start taking any substance suddenly, then the withdrawal symptoms occur. And these withdrawal symptoms are very dangerous, because when the withdrawal symptoms are there, then what I said earlier, that the main sufferer is the family members, caretakers. Then those family members are bound to provide the substance user to give that particular substance. Because if withdrawal symptoms are so dangerous that if the person is being not given that particular substance, he may, any fatal effect may happen with that individual. So the psychological dependency uh, to the need, the psychological dependency to the need is anytime, at the bedtime, or at in between. If you're not getting the sleep or something like that, then it is there. So what now the addiction is? Addiction is nothing. It is just the wrong choice. It is just the wrong choice of a person to resort to the psychoactive substances in order to cope the problem of life. Wrong choice, as earlier said. To cope up with the stress, cope up with the other problems of the life, we should try to fight. We should develop some natural sort of the natural power within ourselves, not the artificial. And due to all these reasons, in 1956, the American Medical Association declared addiction as a disease. But still, many families, many people residing in the rural areas, they don't believe it as a disease. And they try to just cure it with some other mode of the treatment, which is not at all advisable. So, it is in nutshell the way of through which we can see that it is the substance, it is the addiction, and it is the dependency. Now, there are various types of the drugs. The one is known as the stimulants, and this includes like nicotines and amphetamines. And what are the activity of these stimulants? These sort of the substances just increases the activity of the central nervous system of the individual. So cocaine, nicotine, or something like that. Then depressants, each this sort of the substances like sleeping pills, sedatives, tranquilizers, alcohol, all these just decrease the activity of the central nervous system. Then hallucinogens, hallucinations. The most prominent substance used for this is LSD. And when the individual using this substance, he may think that he is flying, unable to perceive the exact things, because he is in the state of the hallucinations, not in the state of the illusion. And the cannabis, one of the most harmful substance, it may increase the talkativeness. The person who is using it may feel more happiness, more irritative feeling, heaviness. It is something like that. weed, ganja, solvents, thinners, something like that. So these are the some uh, substances, drugs, which are in the different forms, which is being used very frequently nowadays, the individuals, and it is being affected the mental health of the individual. So now the question arises, why, what are the reasons that the people uses the drug or alcohol or some substances? The one thing is that the peer pressure, the social norms, some professional reasons. Apart from that, uh, some people try to just deal with their symptoms of their mental illness. Mental illness, as I just explained, it is not the sort of any mental prominent illness. For example, the beginning of the depression, the anxiety, the low self esteem, the low self confidence, something like that. So they use it as a self medication. उनको किसी ने बता दिया, they, somebody told them that you take the one cigarette, black coffee, or one peg of alcohol, or the weed in the cigarette, you feel light, you feel relaxed. The other reason may be uh, because they are, they want immediate relaxation, so they use it. But what happens, that these substances or alcohol increases the intensity of the mental illness. Because what happens, as I told, when you start abuse it, then your dependency increases, and that in dependency create the problem that you are not able to have the proper sleep, you are not able to have some sort of relaxation, not able to take proper decision, or not able to express yourself in the well defined manner. So, and there are some such type of the substances, there are some such type of the drugs which increases or which develop the various mental illnesses within the individual. So due to all these things, individuals start taking the substances or drugs as their own choice or as their own convenience or as their own the pocket allowance allow it, because all these things are not very much you can see everyone afford it. So it also depends about the your economic conditions. So how does these substances affect the mental health of the individual? What the problems maybe arises. First, I will go through with some mental illnesses or some mental problems. How does it affect the mental health? Uh, the first thing which I just discussed a little bit earlier about the withdrawal symptoms. It is there. Withdrawal symptoms including feeling of sick, sweaty or shaky hands or legs when you don't take it. What I termed it earlier, the tremors. The tremors are so worse that the person is not able to hold a spoon, a glass, a mug, or a cup saucer. So, due to this substance use withdrawal symptom, because it is the body dependency, body need, and when the family members are not providing, it increases. Then another mental problem, mental health problem may be having sudden mood change. What we used to say, that mood swings. Sometimes we used to say, "Ki, now leave me alone. My mood is not at present in my own self. So don't disturb me. Don't talk to me. Leave me alone." These are the mood changes. Sometimes the person may be very much happy. Sometimes persons may be very sad, very depressive. So mood changes are there, and all these things are very important to the caregivers, to the family members, that they should observe these things, and if it is being seen within the person, then the first observation should be that he has started taking some substances. So at that level, one should start keeping the eye on the person. Sudden mood changes. Then another mental health problem arises, that person develops negative outlook on life. They don't want to live. They used to say, now what should I do? Nobody needs me. Nobody likes me. Nobody just cares for me. So I'm not going to live. So negative thinkings, it is for the life, it is for the self, it is for the other person also. Then the other mental health problem arises, that is the loss of the motivation. No self esteem is there, no confidence is there, and the person is not motivated. As I told, that to just increase the motivation, to increase the self esteem, he start taking the substances. There are so many people that if they want to talk to their boss, then he just take one or two peg of the alcohol, and then he go and talk to the boss. If he is not having that substance, he may not present himself properly. So that is the loss of the motivation. Then depression, very popular and very harmful mental health symptom, depression. And when this depression converts into the major depression, then very difficult to handle the person, because the depressive person can do any sort of the activity, even he will not hesitate to finish his or her own life. And this is the reason that nowadays the suicide rate everywhere is increasing. Now, most every day, every third, fourth day, we are just having these news clips, that is, so much person was killed by this person. So all these things are there. Depression. Then depression, apart from the depression, anxiety is there. Anxiety is important to just get the goal, achieve the goal, but excess anxiety all the time is harmful, and the low level of anxiety every time is harmful. So moderate anxiety one should have. So sometimes to reduce the anxiety, person used to take the substances. It also affects the mental health of the individual. And one of the very important effect of the substance use on the mental health is, that is, the problem with the relationships. Problems with the relationships. Now you see, for the very small discussions, hot exchanges, people can kill the other person. The tolerance has been so reduced. The relationship has no meaning for individual. It is due to the lack of the mental health concept, and it affects the substance use. And a person of substance user becomes very secretive, not very much open, not ventilate himself the herself very easily or very effectively. So these are some mental health effect of the substance use. Apart from this, some sexual problems are also there. Erections problem are also there. For females, to conceive is one of the major problem of the substance users. Uh, Apart from this, some illnesses like cancer, it may be at pancreas, it may be at bowel level, it may be at liver level, it may be at mouth level. Apart from this, high blood pressure and damage of the liver or the pancreas, insulin increase or decrease, that is the diabetes, all these things are there. Now, uh, apart from this, we can find it out that when the excess substance use are being taken by the individual, the chances of developing psychosis or psychotic disorders are very much prominent. And now, what is the psychosis or the psychotic disorders? Psychosis is a medical term, mental in regard of the mental health or mental illness. And if any individual is having psychosis, he will or she will process the world around himself differently to other people. What in short, in very simple word, if a person is having the psychotic disorder, he or she develop their own shell, their own world, and he want to live in that the world, in that the shell which he or she has developed, and he will not allow to enter anyone in that particular shell. That's why when I was discussing the various diseases, then one was various affect, then one thing I just explained, that is being the secretive. The person becomes so secretive. So he just roam about the shell in which he or she is living. Such persons that who are who is developing or have developed the psychotic symptoms, they might see or hear things that others do not. That means they develop auditory hallucinations or the visual hallucinations. They will hear the various voices, they may see the various persons which other will not see. They may believe things other people do not. If you give a glass of water to the person, he will say it is not the water, it is the blood, because he is perceiving the blood. Nobody other is perceiving the blood. Uh, some people who has developed this psychotic illness break from reality. Such peoples have not living in their real world. They are living in their own world, in the fantasy world, or whatever you can say. So, for such type of the variations in the behavior, the individually not mentally healthy. Now, what I said earlier, remember that every time when we talk about the mental health doesn't mean the illness, but when such type the symptoms are there, when the person is abused of the substances, drugs, whether it is the natural occurring drugs or the pharmaceutical drugs, he or she may develop this psychotic symptoms. Very brief, I will just try to discuss or explain that which type the substances affect the individual's mental health. The first, I'll just say about the cannabis, which the cannabis, as I told earlier, known as bhang, dope, grass, hashish, or marijuana, or weed. These are the uh, other names through which it can be known. Uh, when the people take cannabis, why? Because it makes them feel relaxed or happy. But it can also make you feel anxious or feel paranoid. Paranoid is that where the individual develops suspiciousness, doubts, or something like that. It is also the part of psychotic illness or psychosis. So the excess use of this cannabis group of the substance creates this. And if in India, next year, when the Holi will come, mostly at the time of Holi, people use this cannabis group of the substances, and then you see that in what way they react. They are not their own consciousness. They are relaxed, they are happy, they can they can do any sort of the thing, irrespective whether it is uh, it should be performed or it should not be performed. And if anyone is using cannabis, it may affect your health. So the treatment pattern is important. Management is important. So this is the effect on mental health of the cannabis group of the substances. Now, alcohol, very easily available and very popular sort of this this uh, substance. Alcohol is something like what you can say that uh, excess use of alcohol develop alcohol psychosis. It affect your mental health. And alcohol is one type of the substance which is legally available. It is easier to get. Uh, and this substance uh, users feeling of some mental health issues that feel worse. The blackout is there, the anger is there, the uh, behavioral problems are there, and so many other things are there. And this alcohol use may make the individual something you will not do, the person will not do in the normal way of the life. Even person may just do self-harm, suicide, or he can jump or something like that. Anything can be happen. Sometimes what happens that a person of alcohol is driving, the blackout is there, he may commit an accident. Then I just discuss as a one substance, amphetamine. Amphetamine is this substance may make the individual feel wide awake and alert. And this can make it difficult for the individual to relax or get to sleep. Yeah, alert, it makes the person alert and awake, but the person feels difficult in sleeping. Uh, it this substance just develop drug-induced psychosis. One thing was very much clear, that all these substances affect the mental health of the individual, and the psychosis is one of the mental illness which is being developed by using of such substances. And in long term use of this substance, that is the amphetamine, it might make the individual very anxious and very depressed. At when the depression is there, then the antidepressant medication starts. So when the person is using this substance, it is very difficult to get sleep by the person, not able to sleep properly. Then another substance is that is known as pharmaceutical preparation, known as benzodiazepine. In short, it is known as diazepam. When very much pain is there, very much anxiousness is there, very much restlessness is there, then this uh, diazepam is being used. When anxiety is there, the person used to take. What happens? How does the person becomes addict of this substance? When the person is for any medical treatment admitted in the general hospital, and he is not having the proper sleep, the very high level of anxiety of their illness, then the GP, the general physician, or other consultant provide this injection, and he get relaxed. When he come out from the hospital, then he just try to know that what was that particular substance, and just with the consultation of the uh, pharmacy, the consultation with the chemist, he just take out that substance, and they induce it, they use it with their own, either in the IV or IM, intravenous or intramuscular. So people buy it illegally to get relax, or we may say to relaxing effect, they use this sort of the substance. These drugs may make the person feel more calm, quiet. The way you take it may be in the form of pills, it may be in the form of the injection. Mostly people try to take in the form of the injection because it affects very fast. So this is the substance pharmaceutical preparation, that is the diazepam or the benzodiazepam. Now the next is that is cocaine. Cocaine, which is also known as sniff snow sort of the thing. It also uh, such type of the substance which make feel the individual awake, talkative, and confident. Most of the people used to take the black coffee so that they can, when they are feeling sleepy, they are feeling tired, they used to take this. But when excess is being there, it affect the mental health. And the addict of this cocaine, an overdose of this, it started the problem of depression, paranoid, or anxiety. So it, that way, it affects your mental health. Uh, Further, this cocaine substance may cause fit, heart attack, strokes also. And the last but one, that is the heroin, which is known as smack, brown sugar, I discussed earlier. And its use, this substance makes the individual relax and happy. It just takes away the pain, as I told earlier, that when people are not given this heroin or the smack, they feel the entire body, stomach watering from eyes and nose. And the uh, overdose of this substance create the people like total unconscious and not their own sense. So and the mode of taking this substance is different. Some people used to take it in their cigarette. Some people just sniff it on the file paper, and some inject it. And it is very dangerous, and it also takes the life of the individual. So in this way, these are the uh, affecting the mental health of the every individual. And last is, that is the LSD. And I as I told earlier, that this is such type of the substance, after using it, the person experience that things are not real. They are standing on their terrace, they think they are flying, and they can jump from there, and they can have severe sort of the injuries. So that's why it is known as the hallucinogens. So if the any individual has a history of the mental health problems and taking the LSD, it may make it worst and worst. So these are the, in nutshell, the effect of the substance use on the mental health. And if anyone is suffering from it, as I told, that in 1956, American Medical Association has declared addiction. Now, these are the addictions, addiction as a disease, and one should just take the treatment, the management of this. For this, one should just consult the psychiatrist, the psychologist, rather, what one word we can say, the professional mental health professionals, whether the psychologist, whether the psychiatrist, whether the counselor. So, with these words, I just finish my talk, my discussion here. And once again, I am thankful for the organizer of this event for inviting me and sharing my views. And I'm thankful to all the viewers and delegates for hearing me very peacefully and calmly. If there is any question, any queries, any feedback, you are welcome. Thank you. Thank you so much.